So going under the knife, it's a scary concept to anyone.
Yeah, but what if you don't have to do it?
Yeah. Our better buddy Alyssa Stefanova went to Windham Hospital to find out about some new techniques.
The medical technology has advanced significantly in the past few years, certainly 10 years, where patients can undergo procedures which previously required major surgery, meaning general anesthesia, potential for blood loss, a major incision. They would remove an entire organ or a tumor, let's say. But today we know that we can selectively do procedures where we treat just the single problem and not the whole organ systems.
Dr. Steve Lee says that this technology has made it much simpler to diagnose and treat common medical conditions, one being uterine fibroid embolization, a common problem in women over the age of 35.
It's a tumor of the uterus, it's a benign tumor, and it can cause significant life-altering problems. The traditional way of treating these tumors is to take out the entire uterus. So that's quite a major operation.
With today's technology, this procedure is much simpler.
So they require potentially a one-day hospitalization, or sometimes they can even go home the same day.
As opposed to?
Surgery, which would require at least several days of hospitalization, and with the wound healing process and everything could take weeks to complete recovery, potentially months.
Imaging technology plays a major part in these minimally invasive procedures. It can pinpoint the problem and help determine a treatment plan. These images belong to a 62-year-old patient who came here with a concern relating to her pelvic floor. Doctors were able to tell that there was more than one issue.
We could tell the surgeons that there's a colorectal problem as well as a bladder problem and take care of the entire problem in a minimally invasive way. Imaging plays a valuable role in giving a precise roadmap of the structural problems and functional problems to help patients get the best therapy.
With a strong family history of cancer, Aphrodite Provadas says she's been getting regular mammograms for 15 years. She came to Windham Hospital for an MRI-guided breast biopsy after her doctor saw something on an ultrasound.
Explained the whole procedure. Everybody was so kind. I felt very comfortable. It went pretty fast. And the next day, in less than 24 hours, I was back into the things I really like to do.
Did it hurt?
Nothing. That was my biggest fear, the hurting part. Nothing.
Wow.
I did not feel anything.
So for somebody who is afraid to go to the doctor because they don't want to go through the anesthesiology or they don't want to have to deal with the recovery process or the pain, what would you tell them when it comes to this type of procedure?
I would definitely go ahead and no second thought. No second thought.
Imaging is also used for therapeutic injections that decrease inflammation and pain. Under image guidance, radiologists can place a needle anywhere in the body with perfect precision.
Picture's worth 1,000 words. This image is much better than this one as far as showing detail.
What is this like as opposed to the old technology?
So in the old days, people would almost go in blindly and inject agents into the area where they think it's the joint. But now we know that it's precisely placed in the joint where the medication can have its maximum effect.
So tell me about some of the symptoms you were experiencing and what brought you here.
I was having weakness in my arm and my shoulder.
Without any specific injury that could have caused this, Scott Wiesna's doctor turned to imaging to learn more.
So I had a whole MRI sequence done from my brain down my spinal column and then my shoulder.
The images helped the doctors determine that Scott had a rotator cuff tear that was putting pressure on the nerve and causing all of his symptoms.
And I found out exactly what was going on pretty quickly, and they're able to fix it, pretty quickly too, with a minimally invasive, just a needle aspirating the fluid out of that area. I could tell that there was a change immediately, and then over the next few days, the strength definitely came back.
And all the symptoms went away?
All the symptoms went away.
Incredible.
Wow, a lot of people need to go through significant surgery for a rotator cuff. So and I don't know if in every case, but wouldn't it be great to know if you didn't need the surgery?
That's incredible. All right,
Worth
to learn
a
more,
call.
all you have to do is just go to our website, betterct.com. All right, now.